IV Advanced Securement Peripheral Dressing. The purpose of this selected securement dressing is to protect the site and help stabilize the catheter, which is now the standard of care. You need to inspect the site. We now need to clean the site and defat the oils in the skin so the dressing adheres. We use chlorhexidine 2% with 70% alcohol. Clean the site in a back and forth or hashtag motion. With friction, cleanse the site in one direction for 15 seconds. Flip the swab stick over and scrub in the opposite direction for 15 seconds, making sure that you clean the skin beyond the area where the dressing will lie. Allow the skin and catheter to dry completely. Application of the IV Advanced dressing. It is designed to go on with one hand so you can secure the catheter with your other hand. Write the date and your initials on the date strip. Take off the backing. Make sure you hold the dressing on the large tab area so you don't cause touch contamination. Do not hold it on the sides of the dressing, as you can see on the screen, or on the other end, or your fingers will touch the adhesive and cause contamination. Hold the dressing tab with 4 fingers on the back and your thumb on the front. A little tip: if you bend the dressing slightly, curve it with your 4 fingers, it will make the dressing more rigid, so it's actually easier to apply. You will want to position it so that the dressing keyhole or the cutout is just butted up below the catheter hub, but not covering the hub, so that you can access it later if need be. With your non-dominant hand, you can hold the extension set to secure the catheter. Now slide the dressing up, guiding it just so that the keyhole notch goes just below the hub, and drop the dressing so it doesn't stretch. Press the dressing over the hub with your thumb to secure the dressing. You can now release your non-dominant hand and press down on the window of the dressing. You need to secure the base of the dressing. Slide one thumb down on the dressing, right along, pinching against the catheter, right down to the white part at the bottom of the dressing. Now with your other thumb, slide it down as well, pressing firmly against the skin by the catheter all the way down to the base of the dressing. Those 2 sides at the bottom should just slightly touch. Pinch the dressing again around the catheter and press firmly on the entire surface area to ensure it adheres well. It requires the firm pressure to activate the adhesive. Now remove the frame, pressing the edge of the dressing down as you're removing the frame. Now you need to apply the large securement strip. It goes across the hub. Remember, white goes on white. You don't want the white portion of the strip on the skin. The white adheres to the soft cloth white portion of the dressing. So place it so it just hugs the hub, not covering the window. Press it down and pinch it around the catheter. Now remove the date strip from the backing and place the date strip down over the hub. Place the date strip directly on the white portion of the dressing. Tape adheres well to tape. To quickly review the key points for successful application of the IV Advanced dressing: clean the site, grasp the dressing by the large tab, slide the dressing up towards the hub of the catheter, pinch the dressing over the catheter and seal the base of the dressing, firmly press the dressing down throughout the surface of the dressing, peel the frame off, apply the large strip, and apply the date strip. Removal of the IV Advanced dressing. Take the date strip off. Remove the large adhesive strip, pressing down on the hub of the catheter with your thumb to secure it. With one hand holding the hub of the catheter, remove the base of the dressing one side, peeling it back to the window. Then lift the other side of the base of the dressing, roll it back towards the insertion site, peeling it back low and slow. This concludes our program.